Hey everyone, my name is Nancy Tran, registered dental hygienist and Birth Senior Ambassador. Welcome back for another episode of Birth TV. Today, I want to talk to you about water, hydration, and why it's important for your oral health, soft tissues, and your teeth. Drinking water frequently throughout the day helps hydrate and keep your tissues moisturized. When your tissues are moisturized, that reduces the risk for you having dry mouth. When a patient suffers from dry mouth, the tissues are extremely dry, there's reduced salivary flow, and the tissues tend to stick to each other. When your cheeks and your tissues are sticking to each other, you don't have the ability to clear the food particles and rinse away the plaque that you've accumulated throughout the day. Having increased risk for plaque accumulation, that plaque and the bacteria will start to break down your tooth surface and your enamel, and we call that demineralization. Having increased saliva from drinking water will help remineralize your tooth enamel and doesn't allow the acids to break down your tooth surface. So of course we talked about the oral health benefits to protect your teeth and the soft tissues in the mouth, but drinking water and hydrating frequently throughout the day also helps reduce you from having coffee stains, any types of stainings on your teeth from drinking wine, tea. If you're just more prone from the foods that you eat and drink, hydrating and drinking water will help reduce the chromogenic factors and the tannins and the ingredients from the foods that we eat from sticking and adhering to the teeth. For example, coffee has tannins, chromogenic, and then the acids. It's very acidic. Those three elements increase your risk for having staining, the breakdown of your tooth enamel. Being able to drink water throughout the day will help reduce any of those ingredients from easily sticking to your teeth and staining. Of course, drinking water isn't always going to permanently prevent you from having stains. Stains can be temporary. Some of them can be a little bit more stubborn because our tooth enamel is more porous. But if you haven't noticed, we have released our cosmetic whitening tray line, or you can even do our whitening strips. You can touch up and do that and help, but always keeping hydrated, which is probably one of the toughest things that we do. Remember to do, regardless if we have it there. It's just really hard to tell ourselves to drink more water. But it does benefit our teeth in so many ways because it can protect you from having enamel breakdown. It helps remineralize your teeth when you have increased saliva, just staying hydrated, keeping the tissues healthy. Patients who tend to have mucositis due to dry mouth because the tissues are frictioning and rubbing against each other, it's very uncomfortable. So a lot of times I always start off my patient assessments by doing their oral cancer screening, checking the flow, and checking the saliva and their soft tissues in the mouth. If my instrument or if there's foaming or bubbling of their saliva, that's a sign that they're either dehydrated, they're not drinking enough water, or they just finished a big cup of coffee, because tannins actually really give you that drying mouth effect. So whether or not you're a patient or a dental professional that's watching this video, I hope that this is a friendly reminder for you to stay hydrated and drink more water. If you haven't already subscribed, please make sure that you do below, and stay tuned for future videos from Burst TV.